6:07, a lot more to get to live from Las Vegas, including this. When it comes to health care, and so many Americans are worried about paying more, here in town, the Teachers Health Trust is looking to lower premiums and have their members pay less. We're going to talk to them live on the program to see how they're able to get that done. Welcome back. It is now 6:12, and as national headlines focus on health care insurance costs going up, the Teachers Health Trust, which is a 42-year-old self-funded nonprofit health insurance plan for our educators here in Clark County, they have announced that they're either holding rates flat or significantly reducing premiums for some local families in 2026. So here to talk about how they're able to accomplish this is Andrew Helms. He is the Chief Financial Officer for the Trust. Andrew, thank you so much for being here. Obviously, this is attention-getting because you guys are going the other way, and that's the way that most Southern Nevadans would like to go. How are you guys reducing rates or holding steady where the vast majority of Americans and Nevadans are going to be paying more for their health insurance?
Well, thanks for having me, and that's exactly the right question to ask. So this is possible because we operate as a nonprofit. We're a self-funded plan, and we aggressively manage costs without sacrificing health benefit quality. So we invested in cost control measures early on. We focus on preventative care, and we partnered with local providers to manage our expenses effectively. So both of our plans, our Advantage and our Signature plan, we maintain comprehensive coverage and even offer enhanced benefits like mental health support and telemedicine. Our goal is affordability without sacrificing quality. We took a proactive approach. We negotiated aggressively with our carriers. We leveraged data analytics to manage risk, and we invested in preventative care programs. And these steps allowed us to control costs without passing them on to our members.
Are there any tricks of the trade you guys have learned to be able to be such a success and keep costs steady, or like I said, even reducing them for the year 2026 for your customers? Is there anything us regular folks are able to do to try and get our insurance costs down?
It really comes down to accountability. You have to talk to your employer, and your employer, especially with self-funded plans, it takes a great deal of data analytics. It requires a great deal of transparency, and you really just have to make sure that you're turning over every rock. You're making sure that where there's different areas within the self-funded health plan, there's areas in which you can cut costs, then identify those and go after them, because that's where the dollars are. It's not a one-size-fits-all solution. There's different areas in which you can save money, and you can pass that savings on to your members.
Because this is your field of expertise, I may ask a really stupid question because we know how much money is involved with health insurance. But you're a nonprofit. Should we go the nonprofit way as far as coverage for all Americans at some point moving forward? Is that just a pipe dream? Could that even happen?
It's not so much the nonprofit aspect. I think it's more the self-funded plan aspect. When you have a self-funded plan, you have plan administrators that are advocating for the members, advocating for the employees. I mean, we're fiduciaries for the plan. This is taxpayer money. And our main goal, our main mission, from myself all the way down to the lowest staff member, is to take care of our members. And I think that's the key difference between what we do and then what a fully insured plan would do.
And then Andrew Helms, before we let you go, final question. For the vast majority of us here in Nevada, we have employer-based insurance. Is there anything we could be asking our employer, like our human resources department, as far as the person who is our go-to point person at the building? Anything we could be asking them to help us out in 2026?
That's a very good question. And I would advise all HR departments, make sure you get your data, because if you have your data and you own your data, your claims data, and with that claims data, you can make strategic, tactical moves, and you can, make those efforts towards reducing your overall plan costs. And as I mentioned before, then you can pass that savings on to the members.
Andrew Helms, thank you. Really appreciate it. Very important information. And about how many educators are you covering here in Southern Nevada?
So we currently have almost 19,000 educators and about 34,000 lives total.
Wow. Well, thank you, Andrew Helms. We've learned a lot, and I'm so glad with our teachers who do such great work in our community that they aren't going to have to battle their health insurance in the new year. Really appreciate it. Thank you.
Thank you.
Right now.